We've discussed questions that we normally ask. We have also talked about examination that we'll do. But today we'll be discussing the tests that are important for a man who is desired to conceive or for a man who wants to get married. Semen analysis is one of the laboratory tests we normally do. Now, how do we collect our samples for semen? Ideally, semen samples are collected by masturbation. My challenge is that some patients have said that they cannot masturbate. After 2 to 5 days of abstinence, semen are collected by masturbation after 2 to 5 days of abstinence. However, there are some studies that have been done in the recent time that shorter abstinence time, even several hours, can improve sperm progressiveness and DNA fragmentation rates. But this has not been substantiated. In a very rare situation, note, in a very rare situation, semen can be produced at home or during sexual intercourse using a special condom. This is important because for patients who cannot produce in the hospital, but however, this is very rare. But you must pay attention that if there's any partial loss of the sample or difficulties in semen production, this must be reported. Semen parameters is very clear. Vary from one ejaculate to another. Thus, it is better, let me make that one clear again, it's better at least 2 seminal fluid analysis are usually carried out at least 4 weeks apart. 4 weeks apart, especially if the first one is abnormal. If the first sperm count is abnormal, it is usually better to do a repeat, and this must be within 4 weeks. Semen fluid analysis should be used to guide management of the patient. Abnormal semen parameters could not by themselves predict if the patient will be fertile or non-fertile. As the number of abnormal parameters increases, if the parameters are abnormal, as the number increases, the likelihood of the patient suffering from infertility also increases. According to WHO 2010, what are the parameters that we look at? Because I said that as the number of the abnormal parameters increases, then the chances of these patients suffering from infertility also increase. Now, what are the parameters that we are looking at? One, we want to check the volume of the sperm. The volume of the sperm should be greater than 1.5 mil. The volume of the sperm should be greater than 1.5 mil. Secondly, we want to check what we call the pH. pH means the alkalinity or the acidity of the sperm. The pH must be greater than or equals to 7.2. Thirdly, we want to check the total sperm number. The total sperm number, what some people call the total sperm count. Total sperm count must be greater than or equal to 39 million per ejaculate. Sperm concentration. We want to check the concentration of the sperm. That's what we normally do in the laboratory. The sperm concentration must be greater than 15 million per mil. The next thing we check for, we want to check for the progressiveness of the sperm, whether the sperm is moving very well, or whether they are actively moving, or whether they are not moving. That must be greater than 40%. Then we check for the one that are normal, whether they are normal or not. That normal morphology must also be greater than 40 to 60%. But people say there's a way we normally calculate it. And we check for the vitality of the sperm. The vitality of the sperm must be greater than 58%. Thank you very much for listening to me, and I appreciate you all, and you keep on following me. and give me your comment and your feedback. My name is Dr. Ede Edopolo Sazua, the only doctor of hope.